Welcome to Gunmetal TV, the premier destination for everything you need to know about the innovative world of non-surgical orthodontics. I'm your host, Taylor Cole. Gunmetal, developed by Toyota Central R&D Labs, is a game changer in the orthodontic world. This wire is unlike any other on the market, offering properties that can't be found in traditional metallic materials. Whether you're an orthodontist looking for a better non-surgical solution for your patients, a practice seeking to keep up with the latest technological advancements in orthodontics, or a consumer seeking a safe and affordable way to improve your smile, Gunmetal TV has got you covered. Ladies and gentlemen, we have a real treat for you on our show today. Please join us in warmly welcoming a distinguished guest, Dr. Nelson Opperman. An acclaimed orthodontist, Dr. Opperman hails from Brazil, where he kick-started his impressive career in dentistry. He earned his orthodontic specialty certificate from the Dentist Association of Sao Paulo in 1993 and later furthered his expertise by obtaining a master's degree in oral sciences with a focus on orthodontics from the prestigious S.L. Mandic Dental School, Campinas, in 2003. Known for his profound involvement in the studies of bioprogressive and sectional mechanics, Dr. Opperman has dedicated his career to the pursuit of knowledge and the advancement of orthodontic practices. His dedication to academia extends across borders. He serves as an adjunct speaker professor at the Department of Orthodontics at the globally renowned University of Illinois at Chicago, making a significant contribution to shaping the minds of the future generations of orthodontics. Dr. Opperman's passion for his field is not just limited to practicing and teaching. He is also a sought-after lecturer, having traveled to numerous countries to share his insights, expertise, and innovative approach to orthodontics. He has published various influential articles in the field of bioprogressive therapy, solidifying his reputation as a thought leader in orthodontics. So sit back and prepare to be enlightened as we delve into a stimulating conversation with Dr. Nelson Opperman. Hello, Dr. Opperman. How are you?
Very good. Thank you. Thank you for the invitation, Taylor.
Absolutely. Well, can you tell us a little bit about your background and how you became an orthodontist?
Oh, that's a long time already, but let's get back 30-something years ago. When I graduated in dental school, it was 1988. I practiced general practitioner as a general practitioner 2 years. And after that, orthodontics was not that popular at that time because it was really not easy to get inside specialty programs, master programs. But I really enjoyed the idea to manage my prosthodontic cases a little bit better. So when I started to study specialty courses at that time, and I really get passionate to the specialty, and I get deeper and deeper and deeper. Now it's already 30 years. So this is my, let's say, entering to the specialty. I started to see the need of my patients for better prosthodontic finishing, and I started to do orthodontics to help my patients, and I totally switched to orthodontics later on.
So how long have you been an orthodontist, Dr. Opperman?
It's about 30 years.
Wow.
I am not 100% sure because I'm not very good with timing and numbers and things like this, but it's about 30 years.
Wow, that's
Since
incredible.
1990 something, yeah.
Wow. And then for someone who may be watching this and is in need of gaining confidence in their own smile, where are you located?
Okay, my office is located in the city of Campinas, in the state of São Paulo, in Brazil. So I'm born in Campinas, so I'm from here. I'm born and raised here. So, and I am in this place, in this office, about 6 years already, in this location here.
I see. Well, you're certainly an expert in your field. What would you say sets you apart from the competition?
Uh, you mean competitors in my specialty, or
Yes, in your
let's
specialty.
say because honest, I am a professor as well, so it's depending uh, in what kind of field you want to go deeper. So it's in the specialty itself. I can easily separate the competition in two sides, which is the trend now in orthodontics. Basically, our specialty is in a not so interesting moment, to be very honest to you guys. What's going on to the orthodontics and dentistry, overall dentistry, in fact? Orthodontics is being divided in two big sides. One side, I can see clearly doctors focusing too much in cosmetic dentistry, which is very give a nice smile for the patient. And the other side, I see very little people concerning the doctors, I mean, concerning and how to treat the health of the patient using orthodontics, and also at the end deliver for sure in the package a nice smile. So, and the patients are being very exposed to marketing, and the marketing is very heavy in order to deliver only smile as a final result of the orthodontic treatment. I don't like this very much. So I am not inside of the competition to deliver patients just a nice smile. I am a kind of doctor that gives to the patient complete treatment of health. So, and I see the health treatment, this kind of doctor is kind of little by little disappearing. And it's more, especially the kids that coming out of the dental programs and specialty courses. They are very, very, let's say, driven by the nice smile thing. I I don't like this perspective. So in terms of let's say competition in my side, the competition is small because there's little people concerning about the oral health of the patient and overall health of the patient. So the competition about the just a nice smile. I am not this kind of doctor, so I like to treat my patients more, let's say, comprehensive style.
Yes, yeah, that makes a lot of sense, their overall health. And you mentioned that you're a professor. I can imagine
Hmm.
that you're in touch with the latest trends and technologies, but
Yeah.
beyond that, how do you stay up to date in the field of orthodontics?
Okay, so as a professor, I teach in many countries. I am academically speaking, linked to the University of Illinois in Chicago, the UIC, but I am also linked to Vienna School of Interdisciplinary Dentistry in Austria. But I also teach in many countries. I teach in Mexico, I teach here in Brazil, Colombia. I am very active in Vietnam, and I am starting a new program in Thailand. So I travel a lot. In Europe, a lot as well. So I give courses in Italy, in France, in Bulgaria, Romania, many countries. And so this way, I am always connected to the students and the professionals in these areas, and also many professors. So we exchange a lot about cases and how to treat and how to teach certain topics. So I am always connected with the people with let's say personal communication. Plus, of course, I study hard with the journals, the most important journals. As a professor at University of Illinois, I have access to the major journals, let's say the class A journals. Plus, congresses. I usually go to the most important congress, and we exchange a lot as well with friends, and we participate of presentations and so on. So I am very active. So this is makes me very updated.
Yeah, very well rounded in your depth of knowledge in the field. And you spoke a bit about this, Dr. Opperman, about the difference between orthodontics treating the smile and orthodontics that treats
Hmm.
the whole health and well-being of the patient. In your
Hmm.
opinion, including this, what are some of the most important factors that you consider when treating a patient with orthodontic issues?
Okay, this is a very interesting question, Taylor, because this is what is going on now. It's just completely inside with the new trends. Diagnostics, which should be the first major concern of a doctor, is being little by little reduce it, and reduce it. There are many whys. We can go and talk over this if you want, but basically, the new professionals, let's say the new orthodontists in the field, they are not very interested in go deeper in diagnostics, understand the function of the patient, and so on. And they are just concerning about how can I make that crooked teeth aligned. Basically, this. So if I can make canine to canine nice and the patient feels good and happy, this is my goal, and that's it. So the people, the orthodontists are really not really concerning or caring a lot about the patient's problem. Is just listen to the patient first. Let's say the chief complaint of the patient. So I want to have a nice smile, but they don't understand and they don't explain to the patient why the patient is displaying a bad smile. There's always a why. So the teeth become crooked by a reason. It's not just because the teeth are not nice or the shape is not nice or something like this. There's a reason to have a malocclusion or a bad smile. So if you just give front teeth alignment and forget the rest, certainly you can even make the patient become worse. You can make the case
Wow.
become really, really bad. And the
Wow.
patients usually do not make a connection between the alignment of the teeth and certain other, let's say, factors happening. For example, headaches or neck aches or the deafness or hearing impairment or tinnitus or certain, a lot of things can come from a bad occlusion.
Quality of sleep as well, I hear.
Quality of sleep, absolutely, sleep apnea, and also there are many connections between the malocclusions and certain levels of depression or anxiety or things like this. There's also psychological problems behind.
So, Dr. Opperman, could you share some of the reactions of patients when they hear that you can assist them without any surgery being involved?
Oh, they usually come to my office with already 5 or 6 expert opinions from the other doctors. In my city, we have a lot of surgeons, so they usually go to they. The sequence is something like this: they have a problem, they go to a doctor, medical doctor first. They usually search for a dentist. So second, the doctor says, okay, your problem's not coming from your, let's say, hearing or from your brain problem. You should look for a dentist because your mandible is causing the problem. And when they start to look for that, immediately they go to a surgeon. Okay, this is the logical sequence, the common sequence of a patient. They go to a surgeon, and the surgeon, of course, want to treat the patient's surgery, but they scare into things. First, the price is not cheap. So to make a surgical treatment involves a lot of things: hospital, anesthesiologist, and couple, let's say, even months of recovering after the surgery. So they scare and they start to search for a second opinion. So this is what happened when they come to my office, and they have about 5 or 6 other doctors referral for surgery. And I tell them, your case is not really a surgical case. We can make a solution for you and without surgery. And they simply get like, not shocked is not really the good word, but let's say they don't feel very confident because it's just one doctor against another 5 other opinions. So, but I say them, let's give a chance. Let's give a trial. And I can give them certain trials to understand how going to be their bite before we treat. And they feel really much better. And after the treatment, and we can reach our expectations of, let's say, remove or take the patient out of surgery. At the end, they become super glad because it's a lot of money that they don't need to invest. And second thing is the surgery itself, because surgery always involves certain risks. So they become super happy. And this is certainly a source of patients because patients talk to patients. So my office now is very busy with cases like this.
Right, I can imagine, yes. Well, you've had an impressive career. What would you say has been the most rewarding aspect of your work and why?
Oh, the rewarding aspect of my work certainly is make the patients healthy. This is what makes me really, really good. So I see kids from 3 years old into patients. Let's say the older patient at the moment here I have is about 75 years old. So there's no time limit for a good orthodontic treatment. There's no time limitations for I have a good oral health. So at the moment, I can tell you that the patients look for me, and I can tell them and explain that many side problems they have, they even don't imagine, comes from a malocclusion. And after we show and we make like a test drive, what we're going to be the final occlusion of the patient, we can make something as a test bite, and they feel really much better. And this is something that there's no price there's no money that can pay this for me, because at the end, the patients feel confident. The patients stop to take medicine, stop to go to the hospital very often. So it's a quality of life we can deliver from any age. So some parents come very desperate and they really relieve. They have a kid, the kid can keep going their life. I have patients that I treated at age 8 or 9, and now it's 35, 40 years old. I'm treating now the second generation of the patients, kids of my patients. This is really something that makes me so super glad.
Yeah, yes. I bet so. Well, orthodontics is a field that significantly impacts people's lives and their self-confidence. And you've shared some examples, Dr. Opperman, of where you've been able to help people and have seen them grow up and live healthy lives because of the work that you've done. Could you share a story or two where you've witnessed a transformative change in a patient's life and as a result of your treatment?
Oh, yes, I have very interesting ones. I have a guy, he was super shy. This is usually a very common situation, depending on the severity of malocclusion. Usually patients with big overjet where the upper teeth is very forward to the lower jaw. This kind of patient they are usually super shy. They don't talk, they don't smile, they don't show outside, they hide themselves like in a shelf. So this guy started to come here, and he was about 17 years old at that time. Now he is, I guess, 30 something. It's a long time I don't see this guy. But at that time he was super shy, and I told him, I would make you, I can make your smile really much better, and I need just your compliance here. Please help me with the treatment. Use the appliance accordingly. Just take care and just let me go and do the job. So when I finished the case very, very nice. And that kid at that time was really making some plans. And then he said to me, maybe I want to marry. I want to find a girl that accept me the way I am. And I will marry at 18. And I want to have a family and stay here. And he was very, let's say, accommodated with that situation. And I told him, wait, let's treat you, after that, let's see what happened. So I treated this guy in 2.5 years, about this period of time was the treatment, and this guy completely changed. And now, to give an idea, he's a commercial pilot, a captain of a company in China. So, and he always come to Brazil, and he stopped by to my office to have a coffee and shake hands and give me a hug for me to completely change his life. So he's living in China now because of his work. But he learned 3, 4, 5 different languages. He's become incredible in his position. This is one of the very interesting stories that I had here, and I have way more stories. Certainly, the cases that comes here to me with a very big deformities are the ones that really gives me more, let's say, feedback or changing of life.
Yes, yes. Well, I want to pivot a bit and talk about gunmetal. Why do you use gunmetal?
Gunmetal is an interesting alloy. Because in the past, basically, if we talk about the history of wires, and I started in 1990s working stainless steel only, and later on came with nickel titanium wires to be like a memory shaped wire. And in the beginning of my practice, we had to bend a wire in stainless steel. So it was really hard. It was tough to do, because stainless steel is, of course, stiffy and takes long time, and it's very painful for the patients at that time. Later on came the nickel titanium, which was supposedly to replace the wire bending. And after a couple years doing nickel titaniums in my office, I recognized the wire has a very nice property, but is not exactly to replace wire bending. So it does something that really the wire bending, it does something that wire bending can be really much better, okay? So in certain cases, nickel titanium works good, in certain cases not. So we recognize this, but takes about 5 years to practice and to test anything new in our field. Later on came new alloys, for example, TMA, and the TMA is supposedly to be softer than stainless steel and continue with the wire bending. But we had a problem. This alloy fracture a lot. So we bend the wire and we have a lot of problems. And because the wire fracture, even being lighter than stainless steel, we could do certain things very nice and became very popular for certain cantilever mechanics. Just because of this, because it's easy to fracture, and the doctors start working little pieces and working as a cantilever. So gunmetal came exactly to be in between these things. So this is what is very interesting, because it's easy to bend, it's softer than stainless steel, and you can make wire bending, and this wire is not easy to fracture as TMA. And a part of this is even lighter than TMA. So I believe the gunmetal came in a position of the, let's say, our needs in the office to be exactly what should be the TMA in the past. So it's kind of replaced the TMA in a very better way. It's really very nice wire, and I work almost every day with the gunmetal in my office.
We've just had the opportunity to get to know a bit about Dr. Opperman and his remarkable work. But don't go anywhere. When we return, we'll be delving into some of his captivating case studies. So stay tuned to hear more about his hands-on experience helping patients achieve their perfect smiles using gunmetal wire.